Thank you, Ed. I appreciate the work that you guys do trying to save the resources of the Pacific Northwest, particularly salmon. As you know, I'm very interested in that, and the ones that come to Idaho or don't come to Idaho anymore that should. Abigail?
Mr. Chair, I'm happy to tell you that my daughter is a Nez Perce tribal member.
All right. Good. Abigail, I don't think you could be any more upset about what's happening with murdered and missing Indigenous women than I am. We look back at 9/11, and we can all picture on TVs watching the towers come down and travesty that was. We lost 3,000 people, but it was all at once. So it was very dramatic, obviously, and it's burned into all of our memories. We lose twice that many women, tribal women, across this country every single year. 6,000. I had heard about it kind of in the ether, but about a year ago I was watching the Idaho Reports on, the Idaho Reports program. I was watching it on TV, and they had a woman on from the Nez Perce tribe who was active in addressing this issue and stuff, and I sat and listened to her for a half hour, and I thought, why doesn't the rest of the country know this? Because I will guarantee you that if the rest of the American people that are good people knew the facts about this, there would be outrage. And yet very few people know about it. Very few people know how many murdered and missing Indigenous women there are. You can bet there's going to be a hearing on it. And we're going to call in the Department of Justice. We're going to call in people that know about it and find out what's going on and why is it going on and why are we not addressing it. And I suspect a lot of that is going to be, not all of it, but some of it's going to be inadequate law enforcement with the tribes and that we haven't funded and a few things like that. But it's going to be a big issue, and we need to highlight it so that the American people know about it. But why has the news media reported on this?
So our original research in 2018, we actually took a look at media and found that media not only was less likely to report the murders of Native women, but if they did, they would do things like show their bodies, or instead of showing a picture of them with their families, they'd show a mugshot, for example. So it also creates stigma and prejudice. So we have been working actively, and the Native American Journalists Association has been doing an incredible job on working with media, and we've seen some significant changes, but more needs to be done. When it comes to the non-actions of the Department of Justice, specifically for the urban Indian population, is that one of the things that's supposed to be done under the Not Invisible Act is focused on the data. So we do know that 6,000, I actually think it's probably double, if not quadruple. It's just the data doesn't exist. And so under the Not Invisible Act, Department of Justice is supposed to be working towards capturing that data, and they have not worked with the urban law enforcement. 78% of Native people live off reservation and village lands in urban areas, and it makes us invisible. So the Not Invisible Act, I love the name, but we're completely still invisible. So the Urban Indian Health Institute is the only organization that I'm aware of in the nation that currently works with law enforcement and has been redoing and working with them on and fixing their data systems. But why are we doing the work of the Department of Justice under the $2 million that I receive from the Indian Health Service as a tribal epidemiology center? And the lack of accountability and the lack of them investing in and ensuring that those living off reservation actually receive the benefits of Savannah's Act and the Not Invisible Act. I am excited to see the recommendations that came out from the Not Invisible Commission, and some of the answers from the Department of Interior are definitely lacking, but we need to see what happens for those of us who are living off reservation. I am a tribal member that goes back and forth to both my homelands in Alaska and in Oklahoma, and I deserve safety regardless of where I am.
Absolutely. Thank you. Ms. Pingree.
Yep. Thank you. And thank you very much. Thank you both for your passion on the issue and the work that you've been doing for so long, but also being here today and providing us with so many important facts. And I really appreciate the chair's decision to hold the hearing. I think it'll be very impactful, and I hope that we will see some level of change going forward from that. So thank you for the work that you've been doing. And Chair Johnstone, thank you. I appreciate and feel sympathetic towards the reaction that you had hearing about this, because everyone has a family story, and I
didn't know it was going to happen.
yeah, it's not easy when those moments happen. But also thank you for the work you've been doing with natural resources and salmon, and for the challenges that your community has in relocating. I hope we're really able to put more focus on that going into the future, and how we support those tribes that have to move and have natural resource issues to deal with. So thank you for being here and talking to us
Appreciate
about
that.
Jane.
I do live in Tohola, although I'm with the Northwest Indian Fish Commission on this part of it, but I worked extensively as 20 years on the school board to get our children out of the tsunami and flood zone. And now we are, through the state of Washington, their resources, number one on their list to move us, our little ones, through high school up above that elevation level. So appreciate that.
That's great. Thanks. I yield back.
Josie.
Thank you both for being here, Abigail. Thank you for your passionate testimony today. We can spend all day talking about the data, but I'd love to get with you, get my office with you, so I can learn more about this, and so hopefully we can put an end to this epidemic at some point. And at least, as you said, Mr. Chairman, it only recently with popular media, I think probably with arguably Yellowstone, did anybody know that this was kind of an issue. At least in the population writ large, and when we talk about suicide and hopelessness, all those things go together. So if you feel isolated and hopeless, that there's no law enforcement, that there's nobody cares about your people, nobody cares about your women, then it leads to desperation and drug abuse and fentanyl use until you die, or suicide. So they're all linked together. They're all linked. So I need to learn more, and I want to work with you to do that. And anybody, and Esther, your passionate testimony as well. You're a force of nature, so be out there spreading that word, because especially I'm going to be here for a long time on this committee, working with the chairman and everybody here. So this is not a left or right, Republican or Democrat. This is an American issue, and so we care.
Thank you so much, and we look forward to working with your office. I think about when I first walked into the doors of the Seattle Indian Health Board, I was a young person who was pregnant, who had been experiencing suicidality since the age of 9 years old. And my very first counselor, not at Seattle Indian Health Board, but elsewhere, I made her cry. I comforted her at the end of it. And that is one thing that we have found in our research, is that there are not enough behavioral health specialists who understand the unique circumstances of a father being told, like me, we're not going to investigate your daughter's rape because she's just an Indian girl. What happens to that father and what happens to that daughter? And I knew when I walked in the doors of the Seattle Indian Health Board, like all of our urban Indian health programs, that I was supported, loved, and I had culturally based services, even though they were limited around me. And so that is what we are doing at the Indian Health Service for all of us funded in the ITU system of care. How do we ensure we get the appropriate resources? And when it comes to law enforcement, I get to work with law enforcement across the country. They want to know. We have so many good law enforcement who are not getting the resources to understand how to address this crisis, and that is the failure of the Department of Justice.
Thank you. And I just want to add to it. I want to make it clear that I wasn't trying to refer to anything about Yellowstone or anything like. I don't have any tribes in my district, but I'm proud to be on this committee and learn about these problems, because the human trafficking issue in this country is a crisis. It is an epidemic, and I just need to learn more. And so I can't wait to work with you.
Look forward to it.
Ms. McCall.
Thank you. Back in the late 90s, there were stories of women missing in Duluth, Indigenous women. Nobody really understood. Well, maybe they just left. It was a bad situation at home. And when I got on this committee and learned that 84% of my Native American sisters would experience sexual violence, that was mind-blowing. And then when we first started visiting, and you might remember this, Mr. Chair, with Mr. Cole, some of the tribes, we were talking about the backlog of rape kits, how there weren't rape kits available. No city, no county, no state in this country would allow that to happen. So then we were going to fix that. And then finally, because of hard work of tribal leaders, tribal women, we started hearing about what we needed to do nationally. So New Mexico and Washington State are two of the states that have the highest numbers. My state, Minnesota, has a pretty high number. But we're not sure what that number is. Is it 27? Is it 54 between 2012 and 2020? So we don't even know in 8 or 10 years what the real number is. So we took action, but the reason why we took action in Minnesota is the Lieutenant Governor, member of White Earth, and having 3 members, tribally enrolled women, in our legislature who had allies who just didn't know how to lead on it. So we were the first state in 2021 to put together a state task force on it. We're trying to get it resourced, but with all the stories that we heard about counties and cities and the feds not working together on what happens on reservations, and there's so much more work to be done. So thank you for bringing it up. And when you meet families and when you meet victims, it changes your life. It makes you mad, but then it makes you determined. And I know you said you were mad, but I could hear the determination. Thank you for your testimony.
Thank you so much, and we continue to be so grateful to the work of Lieutenant Governor Peggy Flanagan and the team in Minnesota who have really set up an example of what it could look like for a state to take action. And the data issues continue to be a problem there, which we continue to consult with them on. And my organization, the Urban Indian Health Institute, has funded both tribal communities and urban Indian communities in Minnesota to specifically take action on gathering data appropriately. So again, we are working to do the work of the Department of Justice that they're supposed to do under the Not Invisible Act. And like you said, I'm angry, and anger can be a very good emotion when utilized appropriately. We have to be effective, and that is what is lacking in the federal response right now.
So we're raising awareness with license plates now, and the money's going to go back into helping address this crisis. If you would, because I think you'll be more eloquent at it than I would explain. We have Amber Alerts now, too, in Minnesota. If you would explain the red hand on the mouth.
Mm-hmm. So actually that brings up, and this is in my testimony, the FCC has put forward a proposal to establish what they're calling an endangered persons alert system based on what we did in Washington State, which is in what we call the red alert. It was then used as an example now in the state of California, the feather alert. So similar to the amber alert, our silver alert. So when an indigenous person goes missing, the screens that we have, it pops up. And we've actually seen about 75% success rate in utilizing those. So the red hand across the face was started by a young person who was running on behalf of indigenous peoples. She was in California, and it represents both the silencing of our people, and for many different tribes it's different. So for Pawnees, red is the color, our first color, it's the color of prayer. So I see prayer in it, but I also see the blood of those who have been silenced. And so the red hand allows us to, again, use symbolism, which we do see in the media today and has really helped with raising awareness of not only invisibility, but also the strength of our people. Because the one thing we can't ever leave behind is the fact that despite all of this, we are still here, we are still vibrant, we are still building strong, beautiful tribal communities, urban and rural, and we will continue to do so. However, we shouldn't have to do it under such levels of injustice. And that red hand is one of the ways for us to raise that awareness and push it forward. And it's also an opportunity for all of you to show that you stand with us. I'd love to walk into all of your offices and to see one of those red hands, which we have in bumper sticker. I can get it for you. I'd love to see them in your offices as a way and as a recognition that you stand with us.
Mr. Edwards.
Thank you, Mr. Chair. Again, I'd like to express my appreciation to Mr. Johnstone and you, Ms. Echo-Hawk, to tag on to many of the things that I've already said. I think you're going to find a great deal of folks up here care. It's unfortunate that you're dealing with issues that are somewhat hidden to the rest of us, and so it's important that you're here to help raise awareness and to continue to be here to help raise awareness. And I ask you to not allow us to let your issues get lost in the noise, of which there's so much up here. So thank you for being here. And please make sure my office gets a red hand too. This guy over here will take it back to the office for you. Thank you.
Mr. Kilmer.
Thank you, Chairman. And thank you both for being with us. Chairman Johnstone, thank you for your words. I'm conscious of the fact that hopefully a year from now when you come to testify, the statue of your predecessor, Billy Frank Jr., will be in Statuary Hall, which is a really big deal. And Chairman, I know you knew Chairman Frank, and I know that Ed would want to invite you out to Taholah too, which is just a beautiful part of the world, but also incredibly vulnerable just to flooding and some real challenges being on the coast. Ed, one of the things I was hoping you would just speak to briefly as we talk about the importance of salmon recovery and protecting treaty rights is that Puget Sound Geographic Program. Would you just say a few words about why that program matters?
Thank you, Congressman. It's critically important to us. I mean, the geographic program and the salmon recovery in Puget Sound is that effort that kind of coalesces everything and gives funding to tribes to do the work that's necessary on the habitat. And so much of what we do is threaded in. It's all like threaded or spider web together, and that's a critical piece. And we've been continuing to grow that program, and we've received extensive funds that supplemented, like BIL and IRA, but. What we're after, that those were, we don't want them to supplant, I guess. What we're after is continual support of that geographic program. So many critical areas of the work that are done through that geographic program.
Yeah,
it's really critical for us.
Yeah, Abigail, thank you for being here and for your good words. I can't remember if it was the last time I met with you or the time before you talked about access to behavioral health information and the fact that tribes and tribal epidemiology centers don't have access to their own to data. And since you're with us, I was hoping you might just say a word or two about how having access to tribe-specific behavioral health data might actually help in terms of the provision of care, improving mental health and substance services.
Yeah, this is really something that I think rose to national prominence where people actually became aware for the very first time, although we've always been aware that tribes and tribal epidemiology centers don't have access to the data, despite it being one of the where tribal public health authorities under the Affordable Health Care Act, we are supposed to have access to data, and we don't. And during COVID-19, we couldn't get access to simple things like infection rates within the communities. And out of that kind of birthed the further conversations related to behavioral health and other types of data. If we don't have access to the information, how do we make good data-driven decisions and get information to policymakers for the appropriate programs and response? The access to that information is also, again, under federal law, and tribes should have access to their information. They need to ensure they have the information they need on their tribal members in order to, again, understand the impacts of the ongoing trauma, the need for where we need to invest programs, and where we have gaps and opportunities. And so access to that data is one of the things that the tribes and tribal epidemiology centers have been fighting for. There was a Government Office of Accountability report that came out that recognized that HHS was severely lacking in this. We've seen some response. It has been minimal, and we definitely need to see more. I would definitely advise your offices to take a look at both the report report and the response that came from HHS, because the tribal communities and the tribal epidemiology centers is we're asking for more. We need access to that information so that we can come to you with what is needed within our communities. And also, we know all of our tribes, as has been illustrated today, we're doing incredible work in the urban and tribal settings, and we want to be able to tell you about the successes. But when we don't have the data, we can't tell you that either.
Thank you. I yield back, Chairman. Thank you.
Thank you. And again, thank you both for being here today and for your testimony. It's very impactful on us.
Thank you, Mr. Chairman. I heard Congressman Kilmer, I think in the previous panel, with an invite to the Pacific Northwest, and we'd be happy to host and show you where those critical dollars that flow throughout our funding requests are applied, and we can get you well informed of what that means and where we're going and our successes and what our challenges are. So with that, thank you very much.
Thank you.
Thank you so much.
You bet. Thank you. And our 24th panel, which is the last panel that we have scheduled. Nicholas Lewis, Cody Salter. Don't know if that's close. Dissatel? Okay. Corrine Sams and Michael Rondeau.